Dr. Dennis Onotu is a clinician and the branch chief of care and treatment for the U.S. Centers for Disease Control and Prevention. He joins us now in the studios. Very warm welcome to Newsnight, and great job the CDC and you all out there are doing. But tell us, what could have informed this year's theme? Yes, we can, end TB with its ravaging nature in Africa and in Nigeria.
Thank you and good evening, our viewers. Basically, this year's theme is informed to kind of inspire hope that more can still be done, even though the progress have been, there have been some improvement, especially in Nigeria, but there's still a lot that need to be done. So this theme globally is to kind of galvanize stakeholders to action, increase in terms of increased investment, even in fighting this scourge that has been there for long. So it's kind of to kind of say we can end this, we can do it, and with an end date of 2030. So everybody needs to be mobilized to support this. Increased partnership, collaboration, effort, and also training and equipping health workers to do more, and also intensify the effort to find more cases.
Indeed. But we do know that tuberculosis is preventable, treatable, and curable. Yet it remains a pressing health concern. Why is this so?
Yes, because it's really ravaging, and many people actually live in denial. Like the clip you just played, people either self-stigmatize themselves when they about the disease, so they don't come out. And if we wait for people to appear in the to come to the facility to seek through the normal process, we may continue to carry this burden, and that's why we've not really made significant effort. But in the past 2-3 years, there have been intense concerted effort globally, especially in Nigeria. We've improved our case notification rate, finding more cases, going to the community, being active and proactive about case finding, and also educating people to come out.
Is that an issue in itself, case finding and identification? I mean, if I had like a terrible cough, how do I know the difference between a terrible cough that is just nasty and TB, tuberculosis? So
as an individual, you cannot know on your own. So because some of these symptoms are also of TB, also prevalent with other diseases. But the best advice that if someone is having cough, it's safe to go to the health facility, because that cough potentially, especially if it's lingering beyond 2 weeks, all right, but commonly now, because we want to improve case finding, any cough that is going beyond 1 week, you need to seek medical advice. And because there are things that TB can just manifest in any way. Some with cough that are productive, patient don't need to wait till they are very sick, and family members will have to help them. But when somebody is having cough, the other thing that can suggest TB apart from the cough is fever, which is also prevalent when malaria endemic environment. So fever, there's also weight loss, and there are also diseases that can also cause weight loss. So it's just good health-seeking behavior among them.
It's most important, indeed, yes. But are there individuals who are at risk of this TB, and is there a kind of interrelationship, amongst other terrible diseases too?
Yes, like HIV is a risk factor for increase or heighten. Everybody's can come down with TB, but there are individuals that are at higher risk of contracting TB. So like people living with HIV, that have HIV infection, they can come down.
Because of the low immunity?
Yes, cellular immunity, anything that can, apart from HIV, anything that can impaired on cellular immunity, can also like long therapy with immunosuppressants, and also there are other conditions, like even social conditions, like people that are suffering from alcoholic disorders or excessive, even smoking can predispose, tobacco smoking, all right, and also undernutrition, because there's a relationship between malnutrition, undernutrition, in this case, and risks for TB.
I think the moment there is undernutrition, then you know that the immunity system would drop
because
automatically. That's why Becky, you know, at the advent of the HIV pandemic in South Africa or in Africa, he said poverty is one key factor
that can drive disease. Yeah.
Does that drive the issue of tuberculosis too?
So yes, because nutrition and immunity, there's an interplay, there's a relationship. So if you eat well and you can live, you can be more healthy, your immune system can be strong to fight diseases. So someone that is in a circumstances of undernutrition, maybe there's like when there's people are displaced, they are living in, they can't really have enough to eat, and they are wasting and all the rest. So the immunity is also affected. So they can potentially, when they are exposed to TB, they can succumb to it easily than someone that is really well nourished.
Yes, this message of hope is we can end it.
Yes.
And the United Nations is saying on a day like this, we need to talk about high-level leadership and advocacy. We need to talk about increased investment and embracing new tools recommended by the WHO. But that brings me to a question: what is CDC doing for US CDC doing for a country like Nigeria, which still has some burden of tuberculosis?
So thank you. US Centers for Disease Control and Prevention in Nigeria, we partner with government, support the effort of government in preventing diseases and also treating. And one area that we really have invested and also support the government effort is in this dual infection, TB, HIV, knowing that about 30% of those that have TB, HIV infected, death among them can be caused by TB. So those that have HIV and they have TB, they can increase their mortality by 30%. And we also know that those that have HIV, about 16 times more likely to come down with TB. So we invest in diagnostic capacity, increased case finding among PL-HIV, and also preventive measures that those that are being screened and are not found to have TB or symptoms are also put on preventive therapy to kind of prevent them from coming down with TB, knowing that it causes high rate of mortality in this individual. So we also improve laboratory networks and diagnostic capacity, which is not limited to the HIV. It can just be used for any other person that are working in that facility that is have that diagnostic capacity for TB diagnosis and to improve the quality. So increase training too is also there, and also capacity for even drug-resistant TB testing. We do a lot there, and also technical support to the government in fighting this.
I think Dr. Dennis Onotu has rolled out some of the great achievements, but just before we let you go, any correlation between tuberculosis and leprosy?
There are this, I mean, like the parents, they're in the same group of family, Mycobacterium, but the one for TB is Mycobacterium, is caused by Mycobacterium tuberculosis, and that for leprosy is a strain, one of the member family that is called Mycobacterium leprae, so that causes leprosy. So both of them are chronic diseases, all right? And disease also, the TB in its own, for TB, it continues to be a very significant, that affect multiple organs, the lungs more commonly, that means, and also it can affect other part of the body. It can affect the skin, it can affect the lungs, the lymph nodes, abdominal TB, bone. So it's it affects different organ system. Yeah.
Thank you very much. I mean, the message is clear. It's preventable. Prevention is cheaper.
It's cheaper.
It's not only better, it's cheaper and far better. Thank you so much.